station.
Savitri.
Janit and Prasad. Photo model टिक ऑप्शन इस्तेमाल करता है. Photo model इस्तेमाल करता है.
Prasad.
गाना गाना को photo model का लगा पिकअप पे. Can you do the best examination this patient? So, opening kailangan doctors na. Ano lang? Examine ka na yan. Open ka. Open na before you start. No, patient open ka na. Yung naala. Pakain ka na. Later anyway you're going to put it down, but you know, it makes you very professional. Did you get the consent? Huh? Mama was some by Shishava. You put it in. You buy it here and the Mataka. See that person? Huh? हम मेरे पास कंकुल देगा तो वार्ड में नोट पे दो तो
Can I give an information?
okay no problem
I'm a student. She is 64 years old, female, represented with.
you don't know presentation I didn't ask about I didn't ask you to take a history
On the inspection, there's asymmetry in breast. The right breast is more larger than the left one, and there's a surgical scar on the right side breast, right in the right side of the areola, and there are distended veins over the breast, and there's no
distended visible vein
veins.
what is the condition where you get distended visible vein huh
Model.
huh
MBBS pattern.
MBBS pattern yes Mondos disease Mondos disease superficial probably by this over the breast Mondos disease అది కానీ ఎన్నో కూడా పట్టణాన్ని అప్లై చేద్దామని నేను
There's no skin ulcerations, no skin, no powder range appearance. I'm not good at because they are present here. No skin tethering or puckering. No visible lumps. And there's the right side nipple is larger than the left one, and there is a red color crust on the right side nipple. Amma mona shaabak yanawa nipple පොඩ්ඩක් පිළිකල කරනකොට දැන් now I'm going to palpate the breast. I'm put a balance.
I will palpate in this question line मैं तो palpate का छोड़ के
I'm passing through.
ඒ කවුද නේද බලන්න ජනිත් දියාද ඇස් දෙක ඉවතට ගන්න බෑ ජනිත් ආදරය හස්තරන්ද මේ හරි හිස්ටරි පාර්ට්නර්ස් හරිම ලව් එකකින් ඉන්නේ මාරයි මාර බැච් එක පුදුම ලයිවරක් තියෙන හිස්ටරි පාර්ට්නර්ස් වල. ඒ අපිට දැන් මේ පැත්තට seated question.
Yes.
Oh, in this question.
In seated position.
ආපහු මේ පැත්තට කකුල් දෙක දාලා වාඩි වෙන්න. පොඩ්ඩක් එක්සර්සයිස් කරන්න තියෙනවා. මේ පල්ලෙහාට දාන්න කමන්නේ. That you can offer without wasting your time. So I would like to auscultate why. You have to examine the abdomen. Look to hepatomegaly, not the splenomegaly, the hepatomegaly. Anything else? Scalp from chin and neck. Hurry, lecture. So what is your diagnosis? While running commentary ko palpation is miss huna.
The most probable diagnosis can be the breast malignancy.
Okay. This is the breast malignancy. What is your clinical staging of this patient after examination? T3. Why? Or is the size of the lump that you felt?
I can't calculate the lump exactly. I can't differentiate it from the normal tissue. Maybe it is more than 5.
Okay, you feel a vague lump. You're trying to that's what you're trying to say. Okay.
T3 N naught and N
X. I'm done. Good. So those are the other positive points. She thanked the patient and she tried to help her to get dressed. So you have to help her to get dressed. Okay. Not bad, but there were some deadly mistakes. Okay? Some. But okay. Can be corrected. So breast examination, you get the consent after you introduce yourself, and then you make sure there's adequate privacy, and you make sure there's a chaperone. Guys, make sure everything carries marks. Right? Make sure there's a chaperone. Make sure it is covered. Make sure there's adequate lighting. Because most of the surgeons are males. Most. 99% are males, examiners. Female surgeons are in examiner talking about it. So, if you guys come across a female patient, look for a chaperone. Ask for a chaperone. Chaperones are available. emergency attendant clinical nurse correct, even RHO registrar whoever, right? Outer you know what ask for a checkup. When you start examining, as she did, you start examining the seated portion, right? So first is inspection. So in inspection, the comments were all right. He said there's a asymmetry, although I don't see a major asymmetry on these breasts. So asymmetry, and there's obvious scar on the side and some visible veins, and I don't like the way you handle it. It was too rough. Too rough. You have to be gentle. You try again. Patient ticklish වෙන විදිහට මේක කරන්නේ මෙහෙම. ටිකම නැහැ, but you have to be gentle. So පොඩක් අමාරුල නම මෙහෙම කළා කොහොම ඔස්සන්නේ නැහැ. Some nice. හරි. නිකන් හෝන් ගන්නවා. හරි. lift it up like what I am looking for, submammary infection. So you can either put like this, and or if it's a very small one you can lift it up like this, but you don't do this, right? So you have to be gentle, right? So that's one. And you look for tethering and puckering. Tethering is something that you see, puckering is that you see, tethering that you something that you elicit. And you ask the patient raise the hand above the head. Follow to the මැද්දේ කුස්සක් මේ මෙහෙම තියන්න නිකන් පොලිසියෙන් ඇල්ලුවා වගේ. So there is a tethering, but it is compatible with the previous surgical excision because there's a circumareolar incision on the right breast, right breast. And අත් දෙක පල්ලෙහාට දාන්න. එහෙම තියාගෙන ඉන්න ඕනේ. එකපාරක් කරනවා ඇති. හරියට කමාන්ඩ් එක දෙනවා. අත් දෙක ඔළුවට උඩින් උස්සන්න. ඒකට අත් දෙක උඩින් උස්සන්න. And as she said, there's a problem with the nipple. There's a crusted area over the nipple. Then upper half. The deadly mistake that you did was you started palpating in the seated position. There's nothing like that. Right? Seated position inspection only. You palpate to lift it up and look for submammary infection. That's it. That's how you position the patient. You don't examine the patient like this. But ideal position is 45 degrees angle. You might not get it at the exam, but you can request if you want. So I prefer to have 45 degrees angle. So somehow someone examine like this case. Right? Then you start examining. And the other mistake that you did was you started examining from the affected breast. You start from the normal breast, but you tell the patient. Otherwise she will think that you are a pervert. So you have to tell the patient why you are doing that. And the other mistake is you have to, when you examine, you have to support the breast. Most of these at this stage it's pendulous, they are breastfed. It's not their fault, become pendulous. So you have to support it and get into the chest wall, and then you start examining. Like her breast are okay if you have given a donta palan size account, and then you have a petla. Right? So you support it with the non-dominant hand, and then you examine the quadrants when you examine. අර වතුර පොළොවක බෝලයක් දුන්නා වගේ සෙල්ලම් කරලා හරියන්නේ නැහැ. මෙහෙම කරලා හරියන්නේ නැහැ. Keep that in mind. With the flat of your hand, with the flat of your fingers, you examine the quadrants. අල්ලනකොට ඔළුව මම මෙතන අල්ලනවා. නැත්තම් වෙන්නේ examining stress එකත් එක්ක අරගෙන. අර පොඩි උට වතුර දෙන බෝතල් දාන්න මෙහෙම එබෙනේම තියෙන. මෙහෙම පයින්. එහෙම දුන්නාම අල්ලලින්. ඒ වගේ. මෙහෙම තියෙනව නේද? ආසයි එහෙම එකක් අල්ලලින්. Okay, sellam badwa. So you examine the quadrant support. This quadrant, circular manner. 2, quadrant 3, quadrant 4, central, right? And then examine the axillary tail. Okay, axillary tail. So then you come to this side. I have to come this way. Support 1, 2, 3, 4, 5, exhale. And up. Your back. Out. නෑ නෑ. දැන් මම බලපෙත් කරන ටෝෂන් නෙමෙයි. ස්ටුඩන්ට් දන්නේ රිස්පොන්ඩ් එකගෙන patient ගියාම your patient මේ ළමයිට dementia but I know
Yes, Ivan.
එයා තමයි එයා ටෝෂන් නෙමෙයි තියෙන්නේ. නෑ මම මතකයි තියෙන්නේ. Right. So examine the quadrants like that. So if you feel a lump, then concentrate on the lump. Right? Then you examine the lump. I'm not going to tell you how you examine lump, size, shape, all these things are there. Right? Now these are lump, but I feel more than a lump, I feel scar tissues. I feel scar tissues here. It's a vague lump because she has undergone lumpectomy. Right? So there are more scar tissues here than lump. So if you get a lump, then you characterize the lump. If it is skin attached, I told you what are the skin involvement. What are the skin? You look for skin involvement because if there is skin involvement, you are increasing the TNM stage. What are the skin involvement?
Ulceration, nodules.
Podio range.
Ulceration.
Ulceration over the affect. You have to say complete. Ulceration kela breast lump yatte ula couple ulcer yatte both is it T4? Ne. Ulceration over the lump. Okay. Nodules over the affect, skin nodules over the affected breast. So those are the three. Skin tethering and puckering are not skin involvement. Okay, they are not considered as skin involvement. It does not increase the stage. So look for those changes. Then you look for deep attachments. Deep attachment. आधे में मिनट दिया गया देखा. बाकी वो हम इतना तद करा. That means then you feel the lump. You check the mobility in these two directions. Then इन्हें तद करा. Confirm the contraction by feeling the lateral border of the pec major. You feel it for yourself, do this and feel. You feel that is contracting nicely. So you make sure, you ask the patient to do it and you make sure patient is contracting. You feel it, right? So the mobility is not restricted upon contraction of pec major. Right. So if it is if the mobility is restricted, what does that indicate?
Attached
to the pec major. But is it chest wall involvement? No. Chest wall involvement means beyond pec major. If the intercostals or ribs are involved, then it is chest wall involvement. Pec major is not considered as chest wall involvement. But for the completeness sake, you examine like that. Okay. So that's the examination of the breast. Then you examine the axilla. Right? So in this examination, you have to get the patient to seated, lie down and seated. Because you can't examine the axilla straight away. Right? Because you don't know whether there are breast lumps or not. No? So you can't examine the axilla straight away. When you examine the axilla, you start from the normal side again. You can do two things. As she did, you can do this. So, all what I want is to expose the axilla. To expose the axilla, I can ask the patient to do this. If the patient do this actively, all these muscles are contracted. So axilla is not relaxed enough for me to examine. So I want to expose the axilla, but her muscles has to be relaxed. To do that, I can ask her to do this and keep the weight on my shoulder. So axilla is exposed, but her muscles are relaxed. So, this. Then you examine and look for lymph nodes. Okay? Similarly, you chain the hands and start examining. Right? Again, from the tip of the fingers, circular manner, you feel it against the chest wall. That's how you feel it. Right? So you have to practice this at the exam. That happens. So you have to practice. Yeah, you can do that. You can do that. කොහොම තියලා එහෙම කරන්න. doesn't matter. අතහොම තියාගෙන හේත් කරතයි නේ. ප්‍රශ්න නැහැ පුළුවන්. You just need a practice. පුළුවන් කරන්න. Right. So then after finishing the axilla you have to examine supraclavicular fossa for supraclavicular lymph node, because that also increases the stage. Because if they are palpable, it becomes N3. What is N1?
Palpable.
Mobile ipsilateral nodes. N2
Mobile.
fixed or matted. It can be a fixed node or matted lymph nodes. It can be mobile, but they are matted lymph node to each other. That is also N2. N3 means supraclavicular. මේවා තව බෙදෙනවා subcategories, so you don't need to know that much. So remember like that. So that is the end of breast examination. If you find an advanced malignancy, now as she says it's a T3 malignancy, it's a bit of advanced malignancy, elderly patient, you can tell the examiner, sir, since it's advanced, I find it clinically malignant, so I would like to look for metastatic evidence. So I would like to examine along the spine and look for tender spots. I would like to auscultate the lungs and look for evidence of pleural effusion. I would like to examine the abdomen and look for hepatomegaly and free fluid. And I would like to do a vaginal examination, provided she is married. Look for what? Bilateral adnexal masses suggestive of transcelomic spread into the ovaries called Kuchenberg tumors. When there's peritoneum around the pouch of Douglas, you feel it as an induration. You call it Blummer's shelf. Right? Blummer's shelf. There's a book called Norman Elbrau's. Read that book. It's a very, very good book. It's not Norman Elbrau's. Like BNS or anything. Norman Elbrau's. So read that book. It's a very good book. So you get all these things in that book. Okay? Clear? That is, if you find it malignant, if you think it's advanced, you can offer. You don't have to do it because you don't want to waste your time. You offer spine, you offer lungs, you offer abdomen, you offer VE. Then you should be able to reason it out also. You can't just parrot wage I'd like to go VE, get it at VE. What are the causes? Pelvic inflammatory disease? You can't be like that. There should be a reason why you should do it. And you don't have to do it for a 23-year-old fibroadenoma. If you feel a mobile lump fibroadenoma, you don't have to offer those things. Okay, don't be stupid. Don't ever only for malignant. At the exam, how you word it, sir, I feel a lump, I think it's clinically malignant. So then you can give a TNM stage. You can straight away say this patient is a T3 and not MX. TNM can be applied for only malignant lump. By examining only, you don't know whether they are malignant or not. So you can say, I think it's clinically malignant. If it's malignant, this is my clinical staging after examination. But you still don't know. If it is malignant only, you can give TNM. Okay? Right. Don't give TNM for a fibroadenoma. Right. Thank you. Palpation 45 degrees. But at the exam, you will not get that opportunity. But if the examiner asks, what is the most appropriate way to examine 45 degrees angle? It's very comfortable. If it's a large pendular space, it just sags down out of the bed even. Now at the exam, you will be given one with a mass. Definitely. You will not be given normal breast exam in Kalabaran. So then you have to proceed like that. As far as the exam is concerned. So, if you want to practice, when you practice as a doctor, if you feel it is not, you don't have to. But if patient says, I have axial lymph node, you examine the axilla and also you have to examine the breast. Because it is a draining area. Some patients present without the breast lump, first presentation is axial lymph node. That's what they feel first. Sorry. Any questions? Huh? Normal side is better. Hey, you can have breast meningitis here and axillary metastasis on the other side as well. Yeah. ඒක නම් ප්‍රශ්නයක් නෑ, but generally yes. Any questions? Breast examination. No. Mahansi the weekend casualty kalla. Mahansi? Oh, it's Mahansi though. Ne? Car the Mahansi. නීති මතයි ඈනුම් යනවා. හරි අමාරු ඉතින් ඔක බලන් ඉන්න මට. හා? කෑවද පුතා? බඩ පිරුණා? හිස්ටරි අරන් ඉවරද දැන්? පෙටෝදේ මෙතන හිස්ටරි ඔක්කොම තියෙනවා ඈ. නැත්තම් කිසි ගතියක් නැහැ නේ. ඇවිල්ලා ඉගෙනගෙන යනවා මේක නේ. ඇඟට ගදින්නෙත් නැහැ තාම මේ අපොයින්ට්මන්ට් එක. වදිනවා? එහෙනම් ඊළඟ හොඳට වැදේ ඊළඟ මාස. මේකත් වදිනවා නම් ඊළඟ හොඳට වැදෙයි. ඈ? බලමුකෝ. වැදෙන හැටි. මං හිටියොත් මං ඇවිල්ලා කතා කරලා යන්නම්. ඈ? That's අපද. ඈ?